Hello everyone. Today we are going to talk about twin pregnancy. What do we mean by twin pregnancy? That means you are carrying two fetus at a time in one pregnancy and you are going to get two babies. Well, that's great. It sounds great. But it's not always great. We consider twin pregnancy as one of the high-risk pregnancy, and you should know as a would-be mother what are the basic points. Why do we call it as a high-risk pregnancy, and what extra care you are going to take if you are carrying a twin pregnancy. The incidence of twin pregnancy varies with the age of the mother, with ethnicity. It's more common in black population than with the Asian, and also, which is very important, whether or not she is using any artificial reproductive technique. As we all know, with late age of marriage and high incidence of infertility, we are taking help of artificial reproductive technique, and that's why the incidence of twin pregnancy is on rise. Well, you got your pregnancy test, it's positive, fine. But if you're carrying a twin pregnancy, you will get the symptoms of early pregnancy at that will more symptoms, say the morning sickness, vomiting. So once you feel like that you are having those symptoms more than the usual singleton pregnancy, you must consult your treating obstetrician to confirm with ultrasound whether you're carrying a singleton pregnancy or it's a twin. Well, once it's detected, it's twin, you should start taking the medication, and you all know that we prescribe folic acid as the very initial must-to-have medicine during pregnancy. If you're carrying a twin pregnancy, the dose of folic acid should be doubled. So you're going to take double dose of folic acid instead of 1-2 tablets every day. Now, few things you must know. The incidence of miscarriage is higher in twin pregnancy, along with early pregnancy spotting. We call it threatened abortion, and you should take the medication accordingly as per advice of your treating doctor. An early pregnancy scan is not only important to detect a twin, it's also very important to diagnose. There are two sacs, as you can understand. How many membranes, layers of membranes are separating one sac from the other. So if the separating membrane is a thick one, in medical terminology we call it a diamniotic dichorionic twin. But if the separating membrane between two fetal sacs are thin, then it has got much higher risk, what we call diamniotic monochorionic twin, or it can be a monoamniotic twin. Well, if you're carrying a twin pregnancy, you should visit your doctor at more frequent interval. Start taking the iron and the calcium. As you all know, we prescribe these two medications throughout the pregnancy. But once again, remember, you have to take these two medications at a double dose. Few risk factors for twin pregnancy regarding mother. Everybody in your home is very happy that you are carrying two fetuses and will ask you to eat more. But if you eat too much of extra calorie during twin pregnancy, there is increased risk of developing pregnancy diabetes, what we call gestational diabetes, while you are carrying a twin pregnancy. Not only that, there is increased incidence of hypertension during pregnancy if you are carrying a twin pregnancy. And very importantly, from your baby's point of view, you can go into preterm labor or a premature labor, where the babies will be delivered before they are mature enough. So this is a very high risk for a twin pregnancy. Must take a home rest, not a bed rest, but it's a home rest is advisable, along with more frequent checkup to your obstetrician with regular medication and necessary investigations at regular interval if you are carrying a twin pregnancy. And if you get the symptoms of very frequent cramping of your uterus, you're getting aches and pains in your tummy, must consult your doctor. So don't be afraid. Go ahead with your twin pregnancy by taking rest, a balanced diet, and the required medications. Right. Now, It's that you will be very much afraid what will be the mode of delivery if you're carrying a twin pregnancy. So there are two babies kicking inside your tummy. Both are possible, whether it's a cesarean section or a vaginal delivery. We expect to deliver after 34 weeks of pregnancy, because at 34 weeks the fetal lungs get matured. There are certain medications which are given prophylactically so that the baby's lungs are mature. That's corticosteroid injection, and every obstetrician offers this corticosteroid injection to the mother before 34 weeks, so that if by chance there is chance you're going into the preterm labor, the babies will be born with a mature lung. Now, what should be the route of delivery? Is it going to be a cesarean section or a vaginal delivery? It depends on many factors: the maternal age, the associated complications, the diabetes, hypertension, whether she has developed or not, whether the growth of the twin babies are at par with each other, and what is the presentation of the twin. That means how the babies are lying inside your tummy. If the head is low down, what we call a vortex presentation, we can definitely allow a vaginal delivery. But if it is not there, if it is a breech, that means the buttock of the baby is presenting at the lower end of the uterus, it's preferable to go ahead with the cesarean section. But during delivery, it's really important. Deliver in a well-equipped center, because you can easily understand the uterus is over-distended, the placenta is of larger size, there is chance of excess hemorrhage, what we call postpartum hemorrhage following a twin delivery. That should be managed efficiently in a center, so that at the end you will be healthy and both the babies will be healthy.